really honored and happy that you're here. And just very quickly, I just want to talk about Blomquist Hale. It's the company that is bringing this benefit, and it's a company I'm very honored to work with. And basically, just so you know all of your benefits, we can help with all kinds of things. So I'm just going to go through these really quickly. But I think most of you are aware of the amazing benefits that Blomquist Hale offers, including these webinars like this one. And best thing is, like, it doesn't cost anything. It's like, how cool is that? No copays, no deductibles, readily available, and 100% confidential. Of course, there's always the informed consent, but 100% confidentiality, unless you tell us you're going to hurt yourself, somebody else, elder or child abuse. Other than that, confidential. So going right along with our topic today, addiction isn't funny. It is not funny. And sometimes you got to laugh anyway. So I did really like this cartoon. This is not one of the 7 habits of highly effective people. And in fact, it can be very highly effective people, many of whom I've known, who have fallen into the state. I did want to tell you all a little bit about me, about why I was excited when I was asked to do this workshop. I've been working in mental health. I'm a clinical mental health counselor, have worked in the field of mental health for over 2 decades. And most of that time, actually, I've been working focused on addiction treatment. I've been the clinical director of several treatment centers. I've had many wonderful clients who I've worked with who struggle with addiction. I have great respect for the people who struggle with addiction and also for their loved ones. So the focus of this workshop is on the loved ones, but I am going to spend some time talking about what addiction is, because I think it's important to understand how difficult this illness is for those who struggle with it. So to talk about how it impacts, how the illness of addiction impacts. It impacts you. It impacts everyone who is surrounded by the addiction. It isn't just the person with the addiction who struggles. The people around the person with the addiction struggle. Your relationships can suffer. You can feel hurt. Like, why are these things happening? Why is this person who you so love and loves you doing these destructive behaviors, some of which can be very, very hurtful to you? You can feel very hurt and anxious, of course, and betrayed. And you may worry about your future and the future of your loved one, and sadly, with very good reasons. Hopefully not about your future, but it certainly impacts everyone. So just to reiterate, addiction affects the family and also the broader family. You know, if we look at defining the family, those who have strong emotional ties, there are emotional effects, psychological effects, financial effects, environmental effects. And of course, addiction can also affect society at large, such as with drunken driving, crimes that happen when people with addiction are looking for ways to support their addiction. So it's a very serious and difficult illness, not just for the person with addiction, but also for society, and especially for those who are close to the person with addiction. You might notice that I don't say addict. I don't like that term. So every now and then I'll say it, but I want to be careful about labeling people with their diseases or their illnesses. We don't so much talk about, well, that diabetic over there. Anyway, so I'm just going to keep laboring with a little bit longer terms rather than calling people with addiction addicts. Okay, so addiction is an illness. It is accepted by the medical community and fortunately society at large as an illness. Now, it wasn't always that way. But as we've learned more about how the brain works and what happens to the brain with addiction, we're really understanding that it is a brain disease with biological, psychological, and social components. It's a biopsychosocial illness. In some ways, you can think of addiction as the organ that's affected is the brain. You know, when you break a leg, what's affected is your leg. The bones in your leg. When you develop an addiction, when someone develops an addiction, the organ that is affected is the brain. I want to sort of simplify as much as possible a very succinct way of understanding what addiction is. And I'm going to go into more detail later, but there are the 3 C's of addiction. The first one is it's compulsion. It's a strong urge to use, but the word would be compulsion. The important part of that is that it's a compulsion that you can't control if you have an addiction. Now, I know for me, I get compulsions to eat chocolate or ice cream. Those are, but I can control that. Sometimes it's difficult. Sometimes I don't control it very well, but in general, I can control it. Once an addiction develops, that whole idea of control goes out the window. And if you don't struggle with addiction, it's hard to understand that. So that's a place where maybe compassion and learning more about addiction can be very useful. And it's a compulsion to use that people with addiction can't control in spite of the negative consequences. And those negative consequences can be severe. They can include loss of relationships. They can include loss of jobs, loss of social status. They can include legal issues. They can include losing family or losing children. We've seen this, and sometimes, sadly, they include loss of life. So compulsion to use that you can't control in spite of negative consequences. That is a very succinct definition of addiction. I also really like looking at the 4 C's for loved ones. And I just think it's an easier way to understand this. So for family members, for loved ones, for friends, it didn't cause it. The person with addiction is responsible. You are not. You can't control it. You may try. Most people do at some point. You can't. You can't cure it. Curing addiction, addiction, the way we usually think about it, addiction can go into remission. Don't know if addiction can actually be cured. We're on the fence about that. But you can contribute to it both positively and negatively as a loved one. So you didn't cause it, you can't control it, you can't cure it, and you can contribute to it. I hope that's a helpful way of looking at this complicated issue. Okay, so there's a sort of simplified way to look at how families respond to addiction. And we're going to look at these 4 in a little bit more detail, but behavioral observations, and then a recognition, and then frustration and disenchantment, and then a potential decline into disaster. So let's look at the observation phase first. So in a family, or maybe with close friends, addiction often is unrecognized, especially in the early phase. But there's something not quite right. Family members and friends are starting to wonder what is going on here. Basically unaware of the problem, but there's some confusion about some strange behaviors and some occasional neglects of responsibility. And then as the behaviors continue and get more severe, family members, friends start to go into the recognition phase where they're aware that their loved one is struggling. Oftentimes, they might recognize that they're struggling either with a behavioral addiction, such as shopping, gambling, pornography. They become, or of course, substances abuse, drugs, alcohol. Oftentimes, this is a place where the family members or friends start to try to solve the problem. This is the just say no time. It doesn't work, by the way. And this is also a phase that can be very dangerous in ways for both the person with addiction and family members, because family members can attempt to take on the responsibilities to cover up for the person with addiction, etc. The disenchantment phase. If the addiction continues, there's no intervention. This is true addiction and it gets deeper. It's a disenchantment phase. And this is when the behaviors become more extreme. and more unmanageable. This could be when DUIs happen, or sometimes people start lying, they start stealing, they start cheating. The person who has the addiction at this phase is realizing it's a real problem, but at this point they're in so deep they can't quit. Remember the whole issue of control. They've lost control. There's a lot of guilt and shame for family members and for the person with addiction. And oftentimes it's a very disruptive time where people start to blame each other. It's a very uncomfortable time. The the next stage is disaster. So at this point, the addiction is totally out of control. Oftentimes, there are separations, perhaps, when family members hold the person accountable, they leave, or law enforcement gets involved. A lot of internalization of bad feelings, resignation and hopelessness on both parts, the loved ones and the person with addiction. And this is a time of establishment of, that can be a time of unhelpful family rules. Many times there's secrecy around the addiction, and denial, things like that. So we're not moving into resolution or treatment or recovery at this point. Now, where we hope to go to, for everyone's sake, is into the phase of recovery. And you notice that we didn't say cure, because one of the ways to look at his addiction is that it is a chronic illness with the potential to relapse. So it is a chronic illness like other chronic illnesses that has to be managed. And that's, we'll talk about this again a little later, but this is where family support can be very, very useful. So, but again, to emphasize, recovery is not the responsibility of the family. Recovery is the responsibility of the person dealing with addiction. Family can absolutely support. And what we know from the data is that family involvement increases the odds and the likelihood that recovery can be sustainable. So family involvement is very important. Family support, oftentimes in maybe going to treatment with, or joining some groups with the person with addiction, or maybe family members looking at their own issues, so that they can better support the person with addiction. It can be a time of great growth, although painful, for both people with addiction and the family members. Okay, so I do want to just briefly say, I don't want this to be a downer, but to just briefly say that because addiction is defined as a chronic and sometimes relapsing illness, sometimes the cycles that we were looking at can repeat. Recovery is difficult. There are a lot of contributing factors to addiction, and recovery requires, most of the time, deep changes in a person's belief about themselves and life. Addiction is, one way to look at addiction, it's a coping mechanism for pain, for shame, for did I say pain? For pain, whether it's physical and or emotional. So yeah, recovery from addiction takes time and sometimes involves relapses. I did want to make sure that I said that. Okay, so the rules, just checking my time. Oh, good, we're doing good. So the rules for family members and loved ones. Again, I'm going to say this over and over and over in this presentation. The first one is you have to take care of yourself first. And that can be kind of difficult when you're so worried about someone, but the person you love so much who is struggling with it. You have to take care of yourself first. And sometimes that requires support. What does that look like? How do you manage your own anxiety? How do you manage protecting yourself from some of the consequences of addiction? So learning how to take care of yourself actually could be a whole other discussion that could be a whole other webinar, but we're just going to emphasize, hopefully over and over, that number one is you got to take care of yourself. Educating yourself about addiction. What are the signs and symptoms? Denial what does they call it? A river in Egypt, right? Denial is a problem for both people with addiction and those they love. Denial is something to be very, very watchful for. It's so easy to slip into that. So recovery for both the person with addiction and family members requires quite a bit of self-awareness. Sometimes you want to conduct an intervention. You might want to conduct an intervention, and it can be expensive. There are many ways to do it. Perhaps it doesn't have to be expensive, but it is often best to involve professionals. And you might also want to consider getting professional help right along with that discussion on interventions, or going to support groups for yourself and supporting your loved one if they are going into treatment. So, but first of all, you want to focus on yourself. Okay, so if you're struggling with some loved one who is at any of those stages, when addiction, you want to persevere. Relationships are so important. So you want to persevere, support them, love them, stay with that person at least on whatever levels you can stay with them, psychologically, let them know that you love them, and set boundaries. And that can be quite a balancing act depending what's going on. But don't withhold your love. Do set boundaries. Offer emotional support again, but don't enable the addiction. And kind of say that over and over. This is an opportunity to develop effective communication skills. Because addiction involves a loss of control, just telling people to stop doesn't work. Nancy Reagan, bless her heart, she had great intention, didn't work. We all know that. Offer to attend therapy with your loved ones. That can be a wonderful way to support if they're open to it. Again, know your limits and don't accept unacceptable behaviors. And sometimes that can require some very difficult decisions depending on what's happening. So that it's important, if there are some very dangerous behaviors that are occurring by the person you loved one because they're struggling with addiction, you as a family member, as a loved one, need to be prepared to maintain to protect your personal and financial safety. And sometimes you need to report illegal behaviors if necessary. I think that must be incredibly painful, but I think it's something that should be discussed. So, okay, so let's take a quick look at the biology of addiction and just, educating yourself about addiction. So again, addiction happens here in the brain. It's a brain illness. And it occurs, it's so sneaky, and it's really, it's kind of tragic, because the part of the brain that is affected by alcohol, substance abuse, addictive behaviors is the part of the brain that helps us to survive. So our brain rewards us to pursue behaviors that help us to live and to survive as a species by making them pleasurable. And very basically, the brain releases dopamine when we seek and consume food, sex, shelter, and companionship. Those are all pleasurable activities for us, and we are driven to find them because that's our survival center. So the problem with drugs, alcohol, addictive behaviors is that they target those very same centers in the brain by releasing dopamine and other feel-good chemicals. So just as an example of how, what's the word I'm looking for? Just how cruel, I guess, is as good a word as any, how cruel addiction can be. So cheeseburgers, pleasurable, sex, even more pleasurable. smoking about the same as sex, maybe, at least in terms of how much dopamine is released. But you look at cocaine, it's we're going up the scale. It's twice the amount of dopamine is released when somebody takes cocaine as when they have an orgasm. Methamphetamine, so much more dopamine is released. So what do you think happens? Food, sex isn't as important anymore. What becomes important, because the survival center has been fooled, is the drugs or behaviors of abuse. Hope that makes sense. So addiction changes the brain. So as these survival centers start to change and the focus changes from the original survival skills, food, shelter, sex, companionship, to the drugs and behaviors, the brain starts to change to focus on acquiring the drugs, alcohol, and doing those behaviors. And the parts of the brain that makes decisions, uses judgment, feels emotions, stores memory, and controls behaviors, goes offline, is not the feedback mechanism. It becomes less important in terms of making decisions than the survival part of the brain. It gets hijacked, I guess is a good way to say it. And so the survival center that thinks that the way to keep going is the drugs and alcohol takes over. So it isn't personal. It must feel so personal when someone you love starts to go down that deep descent. It isn't. They are reacting to what is going on in their brain and that compulsion that they can't control in spite of negative consequences. Okay, so what contributes to addiction? Well, genetics is a very big part of whether somebody is vulnerable to addiction. It doesn't mean that they're going to have an addiction, but the vulnerability that's a big part. Tolerance relates to how much of a substance or a behavior, what the quantities are needed in order to achieve the desired effect. And people who biologically have a higher tolerance, so they need more of the drug or alcohol or behavior to get a buzz, to feel good, they're going to be more vulnerable to addiction. So back in the days when I don't know about you guys, but I know that when I was like a college student, if you could drink somebody under the table, that was supposed to be a good thing. Not a good thing. It was a really bad thing, because that meant you had a higher tolerance and you're going to be more vulnerable to addiction. The drug potency, taking stronger drugs, and you're going to develop an addiction much faster. Sadly, we're now looking at the fentanyl epidemic that is so dangerous and is as we know, is killing a lot of people. The addiction, that compulsion to use that we've talked about, comes on much faster when these very powerful drugs are being consumed. How a drug is taken is also contributes to how quickly addiction might develop, so that smoking, snorting a drug, smoking a drug, or intravenous use, it's a much faster way to get to the brain, a quicker reward, and therefore there's more of a desire to do it. It happens quicker, and that leads to a quicker path to addiction. The earlier age and onset, those advertisements that we see that urge us to make sure that our kids don't drink before 21, they're right, because the brain is not fully developed actually until after the 20s, but certainly in the teen years, the brain, the prefrontal cortex is not fully developed. The decision-making ability of the brain is not fully developed until later, and it's much more vulnerable to moving into addiction. Childhood trauma it can lead to addiction because of the psychological effects from childhood trauma that move people to seek relief from some of those memories, some of the, maybe the flashbacks, the traumas. It's the addictive behaviors become a coping mechanism for dealing with that anguish. Learning disorders and attention deficit or the attention deficit hyperactivity disorder are also linked with a predisposition for addiction, and also mental illness predating use. So, bipolar, schizophrenia, again, these are some feelings that people may have that they want to cope, they want to minimize, and drugs of abuse and behaviors can be seen as coping mechanism and then lead into this terrible downward spiral. So genetics count for about 40 to 60% of a person's vulnerability to addictive substances. Again, it's just the vulnerability. No one is born an addict. So if other mitigating factors, such as never trying the drug or alcohol, that's a great way to not turn into an addict or a person with addiction if you have a strong genetic component, but also having a supportive childhood and less stress and all those other things are very protective if there is a genetic predisposition. So it doesn't mean that you're going to turn into a person with addiction, but you have a more likelihood you're more vulnerable. The social factors that contribute to developing addiction, stress. In fact, high stress is seen as one of the biggest factors for relapsing after recovery. So managing stress, learning to manage stress, make it good stress, not bad stress, is really important. Trauma, we talked a little bit about that earlier with traumatic childhoods. The ACEs links right into that. If you're not familiar with ACEs, I encourage you all to learn about it. It refers to the Adverse Childhood Event Study that was conducted by Kaiser Permanente in the late 90s, I think, and links traumatic events that happen in a young person's life before the age of 18 to all kinds of psychological and physical adverse problems, including addiction. Social factors, if a person is associating with peers or family members who use drugs and alcohol, especially to access, there we go. Drug availability, if it's easy to find, chaotic home life, poverty, violence, those are all social factors that will contribute. Mental health and addiction. So I'm not going to spend a lot of time. Again, this is an area that we could spend that could have its a whole other webinar, but just to cut down to that last piece, that about half to 3/4 of people seeking for addiction have some kind of seeking treatment for addiction have some kind of co-occurring psychiatric disorder. When I worked in the treatment facilities over the past several decades, I'd say I worked in residential centers, and so I think that was an even higher number for the people who needed even more intensive care. And a lot of the times the factors had to do with childhood trauma, so PTSD, maybe bipolar, severe depression, illnesses, psychiatric illnesses like that. Okay, so just a brief look at the stages of addiction. Starts with initial use, then goes on to abuse, which abuse is defined as using a substance or behavior to excess where it's starting to create some problems. Increasing tolerance, where you need more of the substances or the behaviors to have the same rewards, to have that buzz or to have that psychological relief. That leads to dependence, where if you're not using the drugs, the alcohol, behaviors, you miss it, you want it, you start to crave it. That leads to addiction, and then which is where you can't control it in spite of negative consequences and the compulsions to use the cravings. and then hopefully to recovery, and then sadly sometimes to relapse. It can start all over, which we don't want to do, but that can happen. So did want to talk really quickly about cravings. So this comes from a Narcanon site. Narcanon is a 12-step program for people struggling with narcotics. And I want to read it because I think for those of us who don't understand cravings, it's hard to really get it. I mean, I know that I think I might have already mentioned this. I can get cravings for chocolate and ice cream. I really, really want it, but I can control it. And very cravings are a big part of that inability to control. So I'm going to read this from the Narcanon site. An addicted person experiencing drug cravings will feel like life itself is dependent on getting and consuming whatever substance is causing those cravings. They will feel justified in saying or doing whatever it takes to feel that satisfaction and relief. But that relief will only last until that drug starts to wear off, which might just be a few hours or might be a day. So, so cravings and withdrawal are somewhat related. Withdrawal is when the drug or behavior substance is no longer reinforcing the reward center, and people get very irritable. Sometimes there's a lot of pain. They can't sleep. They're changing moods. They get depressed, anxious. With opiate withdrawal, sometimes it feels like you're going to die, but you don't. But the aches and pains and the vomiting and the just total misery, their cravings come back. They're tired. And I did want to just mention, this is really important. Usually withdrawal doesn't kill a person. But withdrawal from alcohol or benzodiazepines just might. Withdrawal from alcohol and benzos can be very dangerous and should be medically managed. So I did want to make sure that I said that. Okay, there's one other thing to be aware of, and I'm not going to spend a lot of time on this, but there's something we refer to as PAWS, or post-acute withdrawal. And it's if when family members and people in recovery understand that it isn't immediate recovery, recovery takes time. The brain has to heal, and so the brain's not going to be normal depending on what has been going on, what's happened to the brain, and what the support system looks like, what the environment looks like, what the stress levels look like. So it's going to take time. And the post-acute withdrawal syndrome, that means that once the substance is out of the body or the behavior has stopped, there's still going to be times of painful times. And those times can come and go, and they can cycle a bit. I think that if people don't understand that pause happens, they might think that they're not in recovery. They are in recovery. It's normal. It's really important to know that recovery takes time, that pause is normal, that you can get through it. So that's why I wanted to put a little attention on that. Okay, you might relate to this with people you love. Common characteristics tend to be sensation-seeking, risk-taking, impulsive, gregarious, nonconformist, and sometimes struggle with anxiety. Wonderful people who can get themselves into trouble at times. Addiction changes behaviors, and again, if you are dealing with someone with addiction, you know what these behaviors are, and they can be very disquieting and sometimes dangerous. So there's a lower impulse control, lower tolerance for frustration, higher likelihood of psychiatric complications that come after the addiction starts that may not predate it. Higher risk for explosive violent behavior, higher risk of depression, higher risk of suicide, cognitive and memory impairment, and a briefer attention span. So these are parts of some of the changes that make addiction so difficult to be around. And some of these behaviors, I didn't put them down, but some of these behaviors can also lead to lying, stealing, cheating, driving under the influence, So these can be very, very dangerous behaviors. Okay, in some ways, addiction is like other diseases. It's preventable if you catch it very early. It's treatable. It changes the biology of the brain, and if untreated, can lead to all kinds of bad problems. When you look at treating addiction, you want to be sure to we want to focus on treating the whole person. And as I mentioned earlier, addiction is a biopsychosocial illness. And so we have to treat the biological, psychological, and social components in recovery. So we need all these behavioral therapies, medications, medical services, and social services. No single treatment is appropriate for all individuals. Treatment should be readily available. Treatment has to attend to the multiple needs. Sometimes treatment has to be repeated. So one time in residential treatment or outpatient treatment may not be enough. For some people, going to 12-step meetings or other self-help groups may be enough. Other people have to go into residential treatment and have medical treatment at the same time, so, maybe pharmaceutical treatments. Just depends on the person. There's no one size fits all. Remaining in treatment for enough time. Again, this is recovery takes time. A person's fundamental beliefs about themselves and their situation need to change for recovery to be sustainable. Okay, no one says recovery is easy. And when the world gives up, hope whispers. So just try it one more time. So I'm hoping that this discussion on what addiction is for those who are struggling with the addiction, I'm hoping that this is useful for those of you who are supporting your loved ones. So, but let's go back to what do you do, you, the loved ones? So first of all, when you're engaging with your loved ones, know that it may be difficult for them to ask for help. When a person is losing control, it brings about a lot of shame, and there's also the denial. It's like whatever it is that the addiction has become a coping mechanism. If that coping mechanism is gone, what do they do in its place? It's a very, very scary place for someone who realizes that their life is out of control and they don't know what to do. So, and besides that, their brain isn't working all that well either. So it may be very hard for them to ask for help. If you do want to start talking, and you notice that things are going on, you want to engage and have a conversation with your loved one, find a time to talk when they're not under the influence. Do not engage with rational talk with your loved one if they are high. Do not. Wait for a good time to be able to talk with them and begin a two-way conversation. There are some basic rules of communication that I think are especially important in this context. And I didn't write them down here on my slides, but I'll just say them right now. I think that they're very useful. So number 1, be honest. Number 2, be direct. Number 3, respectful. And number 4 is timely. When is a good time to be talking about your concerns with your loved ones? So again, honest, direct, respectful, and timely. Those are kind of basic rules for communication. Probably most of you are also familiar with using I statements. Blaming your loved one is just going to alienate them and hide them under. So instead of going, you are destroying this family, it's not going to work, right? So you want to say, I feel so much fear and anguish for all of us when I see your behaviors or when I see what is happening right now. Use I statements. Make it about your feelings, not about what they're doing wrong. I hope that's a very, very, very brief communication lesson. But again, make it about you, not about them. Avoid telling them what they should do. Make it a two-way conversation. What do they think might work? What would they be open for? Be open and be aware that you may just get a little bit at a time. You may get some resistance. I wanted to let everybody know about motivational interviewing. It's an area that I have quite a bit of expertise in, and it's an approach that it's a skill-based approach. People can learn how to do motivational interviewing. Basically, in motivational interviewing, that there's an awareness that there is ambivalence, that there is an ambivalence about behaviors, and that's when you can really effectively use the skills of motivational interviewing. And so the ambivalence is that on the one hand, the person with addiction knows that their life is out of control and that they are creating misery for the people around them. On the other hand, they don't know how to quit. They are deep into it, and they don't know how to manage without the substance. So in motivational interviewing, it's an approach where you start to explore that ambivalence. And one of the rules is that if a power struggle starts to develop, it's a signal to do something else. So in the conversations with your loved ones, a power struggle is a signal to do something else. So that's very brief. I know there's a lot of information here, but these are just some of the high points. Stay respectful and listen to their concerns, being a listener, recognizing that this is an illness and that they don't know how to get out of it can be really helpful to increase compassion and patience. Meet them where they are at emotionally and intellectually, not where you are. Their brain has been hijacked. So these conversations may be very frustrating unless you can understand that. They may need to be repeated many times. This next one, don't enable the addiction with money, etc. This is, sort of the classic definition of codependency comes in here, where your loved one is struggling. They may not have money for a car payment. They may not have money for rent. This is where you have to be really careful. And there are no hard and fast rules, because you want to help your loved one avoid being homeless on the one hand. On the other hand, if that's the situation, giving them money might just keep everything going and enabling the addiction. That's something that becomes very personal. If the situation is that extreme, how to manage that. It has to be sort of an individual decision. Sometimes you can get help. It's often very necessary to get help to think that one through, because here is where we, who are the loved ones, can have our own ambivalence. Because on the one hand, if we help with money, with a couch to sleep on, etc., that promotes the safety of our loved one. On the other hand, if we give that help, maybe that continues the addiction. I'm not going to say this is easy. It isn't easy, but it's something to think very, very hard about, and go back to that initial part, that initial mandate, which is that you have to take care of yourself first. And hopefully that will help you make some of those hard decisions when you're struggling with the ambivalence about how do you help a person with addiction, with money, with aid. So I wish I had a clearer way of saying that, but I just want to say it can be very, very difficult. And that goes right along with hold your loved ones accountable for their actions. You know, that just because maybe they're not in control doesn't mean that they're not accountable. So, and they have to be held accountable. So this is probably the hardest area to work through. And again, might be a great time to go sign up with Wonk Tail for a session to work these things through as you make your own decisions as a family member of how to support the loved one. Okay. So let's see, we are just about out of time. But again, I just want to reiterate, the important thing is to take care of yourself, make your mental and physical health a priority, lean on others for support, don't isolate, tell the truth, don't hide the addiction. You might want to be careful who you talk to about, but don't hide it from yourself for sure. Do things you enjoy and consider attending support groups, i.e. Al-Anon. There are lots of support groups or getting professional help. Okay, are there questions?